Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host. I'm a dentist in my training, but we specialize at the Stewart Center for Optimal Health in craniofacial growth, airway development. We help people sleep better, feel better, and just be more healthy by growing beautiful faces. The teeth are, of course, part of that, but it's so much more. It's health beyond the teeth. Today we have with us our good friend, Dr. Matt Barker, Doctor of Osteopathic Medicine in Southlake, Texas. Dr. Barker, welcome.
Thank you for having me.
Yeah, it's good to have you on again. Dr. Barker is a semi-regular guest we have on this program because he has so much knowledge. When I started dental school, or when I started my dental practice, when I got out of dental school, I was put into braces, I think as an experimental project by a senior dental orthodontic student when I was a sophomore or junior, can't remember, in dental school. And I had my teeth moved around, and I never had chronic headaches or TMJ issues. And it started then because my bite was not perfect to begin with, but I had compensated to it, and I was not saying I wouldn't have had problems later, but these issues started. So I'm not blaming the orthodontic student. I'm not blaming orthodontists. This is just what happened. The point of the story that I'm telling is that this really piqued my interest in this whole complex and how the teeth relate to that because, of course, I'm a dentist. We're trained to work on teeth. I found out very, very quickly that total health and wellness and just having vitality and thriving is much more than just having healthy teeth. These teeth and the way the jaws are formed and the way that the joint works and all the bones of the skull and all the muscles and the nerves, they all work together to either enhance your life or to make you miserable. I'm on several Facebook pages that are, I just as a bystander, TMJ Facebook pages, and there are literally millions of people out there in this country and worldwide that are suffering from temporomandibular joint dysfunction, from myofascial pain. And it's all related to the way the nerves and the bones and the muscles in the skull are aligned, and that can just trickle its way down the rest of the body. And so most people think that the skull is just this hard, bone, but it's actually made up of several different bones, and they're all fused with sutures, like little zippers, but they do move. In a skull that you might see in a museum, those don't move because they're petrified, they're dried out. But in a living human body, all those bones move. And when you've got X amount of bones all moving against each other, it can lead to a lot of bad symptoms and headaches and tension and vertigo, just all kinds of things. I have Dr. Barker on today with us because one of his specialties is in craniosacral treatment. So we hear a lot, Dr. Barker, about craniosacral therapy.
Yes.
What is craniosacral therapy? How did that term come about, and what is different between that, what we hear, and craniosacral treatment, which is what you do?
So as an osteopathic physician, that's one of many different techniques that I could get trained in and that I've been trained in. And so the cranial treatments were first developed, the assessment of the dysfunction and the treatments to fix the dysfunction were developed by one of the very first osteopathic physicians long time ago. And for a long time, it was really only taught within the osteopathic profession. And in more recent years, it's been opened up, and now there's courses that massage therapists or physical therapists or chiropractors can take to learn these techniques because they are very useful. And so the term craniosacral therapy was developed when the techniques were starting to be taught to non-osteopathic physicians.
Okay.
And so the techniques, a lot of them are very similar of what an osteopathic physician or a non-osteopathic physician may do. And for me, I don't just do those techniques. It's just one of many different techniques that I use.
Yeah. And one reason that I started working with Dr. Barker is because I would, our typical TMJ treatment for our patients is to put them into what I call a permissive orthotic. It's a clear orthotic, that's a splint, if you will, that they wear on their upper teeth. They can eat in it, chew in it, talk in it, go on vacation. They basically live with this for several months. And we met with a great degree of success. But as I learned more about this whole complex, the skull, and you see all those sutures, those little lines, those are all the different bones in the skull. And there's one in the very center that's highlighted in red called the sphenoid bone. It kind of looks like a bat or a big butterfly. That's a really, really unique bone, and it affects everything that I do as a restorative dentist, as a TMJ specialist, as a craniofacial growth expert. It affects all of that. Dr. Barker, expound on the bones of the cranium and the sphenoid bone and how all that works and why it's important to keep those lined up and healthy.
Yeah, so as you mentioned, the cranial bones are supposed to move. And so the cranial bones all move 6 to 10 cycles per minute. And that motion is independent of your breathing, of your heart rate, of you intentionally doing anything. That's just kind of built into your whole body mechanism. And so the bones that are paired, so where there's two, so your temporal bones on the side of your head, for example, are paired bones, versus your sphenoid bone or your occiput bone in the back of your head are single bones. And so the paired bones are supposed to go into internal and external rotation, and your single bones kind of rock forward and back. The terminology we say is flexion and extension. Mm-hmm. And so those happen together, the flexion and external rotation happen together, and the extension and internal rotation happen together. And so part of my training is to actually be able to palpate that motion or lack of motion. And so when you have lack of motion in one or more cranial bones, that can lead to dysfunction in or even outside of the head itself. Okay.
And I understand that much better now, because about 3 years ago, I took a week-long craniosacral course. It was myself and two other dentists, and there was about 80 DOs, Doctor of Osteopathic Medicine doctors, or they were residents. And I actually learned how to feel those bones moving. And it took me about 3 or 4 days, but I finally kind of got the feel of it, and it was actually amazing when you can do that. Now, that's something that someone that does that every single day needs to be doing. So I refer my patients out to Dr. Barker for those kind of treatments. But if I believe in something, that I want to experience it. And when I went to that week-long course, that really took my patient care to another level, because it's not just about this temporomandibular joint bone where the lower jaw meets the upper jaw, or the maxilla jaw, or the temporal bone. It's about all these working together, and there's nerves and muscles involved as well, right?
Correct. So the nerves are gonna, if you pull up that skull again, there's tiny holes where the nerves from the brain go through those bones to come to the face, to leave the inner part of the cranium, mm-hmm. and then go to the other part of the body. So any one of those holes that the nerve has to pass through can become compromised and partially impinge on those nerves. The muscles between the bones, or the muscles or ligaments that connect the bones and help to allow the jaw to move, can become tight or restricted. You can have abnormal craniofacial development, as you know, and so that can actually affect how the bones develop and grow. And so there's a lot of potential for things to go wrong, but there's a lot of things we can do to fix those. So like even in your newborn babies, when they come through the birth canal, some of those cranial bones can be out of alignment or misshaped and cause a condition called plagiocephaly. And so that's something that we can treat with our hands to restore normal head shape. And you have a pretty rare opportunity in those brand new babies to fix that before the head becomes much harder to change the bone shape.
Yeah, I always tell my patients, if we can get a child very young and we see their craniofacial growth is not where it needs to be, it's much easier to right the ship when they're 3 years old than it is when they're 30 years old.
Yeah.
And these infants, they come through this birthing canal, and the bones of the skull are actually very soft at that young age, right?
They're soft, and they're not as interconnected. So they're kind of like these
floating
bone
around
plates floating in membrane to allow them to come through the birth canal. And so depending on the forces during that process, they may not be in their correct shape.
Yeah.
And so if you let that last too long, then they can become formed in that incorrect shape. And so then you might be walking around with some asymmetries or some flat spots on the head.
Yeah. You know, that's fascinating that this whole thing about the cranial bones not being together in an infant. And I wish that more young parents were educated on that. A lot of them don't know. And they could really solve a lot of their future problems for their child just by having some body work and manipulation of those bones at a young age.
Definitely. I mean, one of the conditions I treat in newborns very commonly, I would say the number one thing that I get referrals of newborns is for feeding difficulties. And one of the contributing factors to the problem of breastfeeding is if there's a lot of compression at the base of the cranium of the occiput, because there's some of the cranial nerves that control the tongue and the swallowing functions are very vulnerable to being compressed in the newborn because those bones are not fully developed. And so if there was significant compression there, that can affect the muscles that control the tongue and swallowing and can contribute to the feeding issues.
You talked about, Dr. Barker, you talked earlier about cycles. Each of these bones goes through a cycle, or how many cycles a day?
It's 6 to 10 cycles per minute.
Per minute. Okay, I'm sorry, per minute. It's been a while since I took my craniosacral course. What exactly is a cycle? Kind of in layman's terms, what is that?
So the technical term, I'll kind of step back, is Cranial Rhythm Impulse, or CRI. And the way I would explain it to someone of what it's like, it's kind of like the ebb and flow of the ocean, how the tide comes in and out.
Okay.
And so there's an expansion force within the body that causes those bones to expand outward, and then it kind of draws back. And so when I'm feeling somebody's head, an exaggerated motion would be there's an expansion and contraction.
Okay. And these are like fractions of millimeters.
Very small.
Yeah.
Yeah, this was exaggerated.
Yeah, right, yeah, and understood. And it really takes a proper training, hours and hours of training, and then years of experience like Dr. Barker has, to be able to feel this and to be able to know, what to do to manipulate the bones back to where they need to be.
Yeah, so I'll kind of touch on that. So all osteopathic physicians in medical school, we learn about the theory and the treatments for cranial treatments, but in medical school, most schools are not going in depth in training DOs to do the techniques, because your average DO isn't going to use it on a day-to-day basis. And so part of my training after medical school in residency was taking extra courses in cranial treatments and learning how to use those at a much higher level. And then above, a step beyond that, in my personal practice, probably the largest single component of my practice is treating dental-related conditions such as TMJ, tongue ties in newborns and adults, and then helping patients or supporting patients through expansion to either treat the TMJ or to help improve their airway. And so I am using cranial treatments on a very high percentage of my patients.
Yeah. Well, and I've got first-hand experience with that because I do tongue release surgeries for my patients, and there's a good percentage of those patients that we do what we call guided releases, where Dr. Barker will be there. He will do body work on the patient first, then I will do the tongue release surgery, and he can then feel by feeling the skull and on the patients, he can feel the tension or lack thereof, and know that if the release has been needs to go further, or if we're right where we need to be. So all of that tethers together, all of the muscles and the ligaments and the fascia in the head and neck area. I don't think I've told you this story, but the first inkling that I got of something like that, because in dental school they don't teach us that. I mean, we learn the bones of the skull and everything, but we don't learn that extensively about what's going on in there, which I don't think regular medical school does either. And now a lot of the DO schools don't even go into that in a lot of depth.
Yeah.
You have to kind of seek that out afterwards.
Correct.
But I had a really, really severe headache. This was probably 20 years ago. I was at work, and it was just like really, really bad. And my massage therapist, who had some craniosacral training, was just across the parking lot. So I called her up and asked her if she could give me a massage. And so I went over there, I told her what was going on, and she never took her hands off my head. And it was just a very, very light pressure, very light. But I swear to you, in 15 minutes, no medications, my headache was gone. It was amazing.
Yeah.
It's just like calming the seas.
It's very subtle. It's funny, a lot of patients after a treatment, it didn't feel like you did anything, but they feel better.
Right.
Or even sometimes the next day they're like, man, I was really sore after that, but it didn't seem like you did enough to make me sore.
Right. Yeah. Sometimes less is better.
Yeah.
So how does let's specifically, being a dentist who specializes in TMJ dysfunction, how do all the cranial bones in the temporomandibular joint all work together?
So your lower jaw is your mandible, and the lower jaw fits into this bone on the side of your head called the temporal bone. And so that's what makes up the temporal mandibular joint, is that connection. And so TMJ is usually related to where there is some kind of asymmetry in how those two bones come together, where the mandible is often kind of jammed into the temporal bone. And so over time, that joint is going to wear out.
Yeah.
And what often happens when patients are having problems with that joint is that the temporal bones will tend to get locked up in either that internal or external rotation. And when the temporal bones are not moving the way that they're supposed to, it can lead to dysfunction of the eustachian tube. So you can have ear fullness or ear pain. You can also have tinnitus or ringing in your ears or dizziness. Those are some of the symptoms that you might not think of when it comes to TMJ, but because of what is housed in that bone, it can be affected. You also have often neck pain, headaches, facial pain, jaw pain. Patients will report the popping and the clicking. So that's all a mechanism of what anatomy is involved with that TMJ joint. And that kind of explains what symptoms patients are having.
Yeah. It's a trickle effect. It really is. I tell my patients it's like an extension cord. You know, you just plug one in and the electricity just keeps flowing downstream. And if you've got pathology here, tension and misalignment, it works its way down. And, you know, the opposite can occur too, but it just seems like so many people's problems from a standpoint of headaches and muscle pain and shoulder and neck pain, a lot of it derived from their joints and their cranial bones being off.
Yeah, and kind of getting to part of the root cause, often I find that patients who suffer from TMJ have a tongue tie. And that can lead to the development of problems later on with the TMJ joint, because the tongue is designed to be up on the roof of the mouth. And with the tongue up on the roof of the mouth, as we breathe through our nose, as our heads develop from newborns to adults, that constant pressure of the tongue helps the palate to expand, the roof of our mouth to expand, and helps our upper jaw to grow to its full growth potential.
Yeah.
And so in individuals with tongue ties, we don't tend to, and I say we because I had a tongue tie and I had it fixed about 3 years ago, but we don't tend to exert enough force on the roof of the mouth, which tends to having a more high-arched, narrow palate, underdeveloped upper jaw, which some evidence of that would be teeth crowding.
Right.
And when that upper jaw is too small, the lower jaw by default wants to sit behind the upper jaw. And so that's pushing your lower jaw back, which pushes the mandible up into the temporal bone. So I find very common patients who have TMJ, they also have a tongue tie.
Yeah. So yeah, it's really interesting. But tongue tie, the tongue doesn't get up, the jaws don't develop properly, the teeth are crowded, the joint gets forced back, TMJ problems start. So if you're an adult with crowded teeth, or if your child has crowded teeth, your chances of developing temporomandibular joint issues, craniofacial pain, are highly increased.
It's like the early warning, the check engine light on the car.
Yeah.
The teeth crowding is definitely an early warning sign that there's going to be some problems down the road.
Yeah. Yep. And how does a unstable joint, TMJ, and how does an unstable cranial bones, how does that affect your posture and basically the alignment of the rest of the body?
Well, your eyes always want to be level to the horizon. So that's going to be the same no matter what. And so if you have some asymmetries from here down, then your eyes are always going to be here. So if
you have to compensate with your
if one of
muscles.
Your eyes is slightly higher than the other, well, that's going to cause your head to have to turn so that your eyes are level with the horizon.
Right.
You can't really walk around. If you walked around, your eyes were not level.
Yeah.
Then it just doesn't work that way, and so that's going to cause your neck, to be more tilted. One side of your face can develop more than the other, which can lead to some issues. The upper cervical spine is very highly correlated with TMJ, and so you'll often have more dysfunction at your cervical 1 and cervical 2 vertebra when you're suffering from TMJ or in patients with tongue tie. What I find is patients with tongue tie, I can feel the tension actually the best at the second cervical vertebra. And I've found that the side of the tongue that's tighter, which you usually have one that's a little bit tighter than the other, will actually cause the second cervical vertebra to side bend and rotate in a predictable pattern. And so if somebody has a right side tongue tie that's tighter than the left, that would tend to cause the second cervical vertebra to side bend and rotate to the left.
Interesting. So for our viewers, if someone is suffering from chronic headaches or neck pain or shoulder pain, I mean, we know that there are a lot of things that it could be, but throwing medication at it right off the bat is not necessarily the way to go, correct?
That's just treating the symptoms. It's not addressing the underlying problem. So for patients that come into my office, I do an assessment on the first visit. I'm looking for these underlying root causes that are treatable, that are curable or fixable. And at the same time, I also am going to start doing treatment so I can alleviate some of those symptoms right away. Patients generally come in pain or with something going on and feel better when they walk out. But my goal is not just to treat the symptoms, it's to find those underlying root causes and address those.
Yeah. Well, and the headache business it's a multi-billion-dollar business, and so much of this could be treated by natural manipulation, a diagnosis and alignment of the bones in the skull and the neck, and therapeutically rather than medicinally. But we have so many. I mean, you turn the TV on and you're going to hear probably 1 out of every 4 commercials is going to be talking about headaches, headache pain, headache medication, muscle medication, over the counter or prescription. And so much of that, I'm not saying none of that is necessary, but so much of it is really unnecessary.
Yeah, so the doctor that actually started osteopathic medicine, he came up with some tenets. And one of the 4 tenets of osteopathic medicine is that structure and function are reciprocally related. So if you have a structural problem, it's going to affect the function. It kind of just makes sense. But for example, if somebody's ribs are not moving in and out when they breathe, well, that's going to affect their oxygenation. If they get an infection in their lungs, it's going to affect their lungs' ability to fight off that infection. It's going to affect potentially blood flow or nerve flow. So there's a big trickle-down effect when there's a structural problem. And if we can fix the structural problem, we're going to help the function of that structure.
Yeah. So, we started off talking about the cranial bones and the TMJ, and now we're into the lungs and the heart and the thoracic region. It's all connected. These bodies of ours are wondrous things, but they're all connected, and we can't ignore one part completely. We have to look at how everything functions together, and that's what I've always been interested in. That's what Dr. Barker does at his practice. Dr. Matt Barker in Southlake, Texas. His information is below. He'll be on the podcast again. Dr. Barker, I want to thank you for being on the show today. We're hands-on. We care about our patients. We don't look at them as a means to an end, a means to a better life for us. We truly want to help people and help human beings, and that's why we're always striving for more knowledge, and that's why we collaborate together so that we can make each other better. And so. Again, Matt, it's been great having you on, and he'll be on more in the future, and you learn a lot from this fine doctor. So I'm signing out. Dr. Hal Stewart with Health and Harmony Beyond the Teeth. Stay safe, stay healthy, and we'll see you next time.